People think these are greatly overused. And the problem is, they'll work on anyone. It's not like depression, where if you give an antidepressant and it doesn't do anything, then maybe you have the wrong diagnosis. This will work on anyone. If you took it, you would be more alert and less hyperactive also. When I was in college, people used to take uppers, diet pills. It's basically the same kind of chemical. To stay up all night. My college roommate never started her papers before the night before it was due. She'd stay up all night working, and she would take diet pills all night just to stay up. So that's an issue, and a lot of people think that we are greatly over-medicating these kids. You'll see a lot of books about, the medicated generation, how we're ruining boys and so forth. Okay.
Question.
Yes.
You say that parenting can hurt, but also can help and hurt. Do you mean grounding or some sort of timeout type of thing rather than talking it through? How do you...
Well, I was thinking more of the kind of parent. If you have a parent, say a mother, who's very passive and quiet, imagine having an ADD 3-year-old. If you are a very high energy person and you love to run around the park, that's going to be a lot easier. And a lot of these disorders are what we call a goodness of fit issue. Does the child fit with the mother? If the child fits with the mother and or the father, it's a lot easier. If they don't, this is one of the reasons we have physical abuse, because the child's temperament does not fit with the mother's. So parenting, obviously not harsh parenting, but a lot of these kids get harsh parenting because they are difficult. I'm sure you've all seen ADD kids. They're hard to be around. People want to kind of squash this. Okay, anything else about that? Okay, conduct disorder and oppositional defiant disorder. I'm sure you've seen a lot of these. Remember that this is really a description. So basically you're describing behavior in conduct disorder. So if you look at 98, you're going to see a description of behavior: aggression to people and animals, destruction of property, deceitfulness or theft, serious violation of rules. It doesn't really mean anything to diagnose someone with conduct disorder, right? You're just saying their conduct's a problem. It doesn't imply any cause. It doesn't imply any treatment, because there are a lot of different causes of this. Oppositional defiant disorder is just a lesser conduct disorder, and you could probably say that most high-spirited kids are oppositional defiant, right? I mean, they don't want to do what you tell them to do. So this is kind of a garbage pail diagnosis, I think, that you give to kids that are being a problem. However, severe conduct disorder often turns into antisocial personality disorder later. So if somebody is severely conduct disordered, say at 7, they're hurting animals is a red flag for being a serial killer later. So that's important. We never used to think hurting animals was like, well, that's not very nice, but it doesn't mean anything. Well, it does. So if you have a child who's hurting animals, you really want to look at that, because they tend to hurt people later. Go ahead, one more with that.
Oops.
Back a little. Back.
Back again.
Yeah. Okay.
Sorry.
Yes, who had a question? Yes.
In my case, the little boy has previously had fire-setting tendencies,
Mhm.
and he oftentimes, after visits or whatever, he'll come home and act out and see nothing wrong with it. He also is mildly mentally retarded. Is that, do you think, due to the situational factor? Is it because he has mental retardation, or is it because he could also have both going on? He'll come in, he'll draw on the curtains of the foster home and tear pages out of the book the foster mom gives him and stuff.
Do you know what his IQ is?
I know it's low.
Like 60s, 50s?
Yeah.
50s, 60s. Yeah, fire setting is something we don't understand very well. It's another precursor to bad problems later. But if you have a mentally retarded child, you have to look very carefully. What does that mean? I'd have to see that individual child. What's the background of the child? Abuse or neglect or?
Neglect. Yeah, he was left for 2 weeks by himself. Mom left and left.
How old was he?
He was
Was he
11.
11. And he wasn't that way before? Or you
He's
don't know?
always kind of had those tendencies.
Right. So you may have a child with particular behavioral tendencies early, and then you add that kind of parenting and neglect on, and then you will make the behavior worse. But I think you really need a good evaluation to see what is the fire setting about. I mean, part of the problem is that fire setting is very interesting to kids, right? Have you ever seen little kids with fire? It is very interesting. And if they don't understand the danger of it, it could be that. But then some people like to set fires so they'll burn things up and hurt people. And you have to find out what the difference is. And with retardation and neglect, it makes it harder to really separate those out. Anybody else? Yes?
What would be the flip side of the person with a high IQ? How would that be?
The only flip side would be that you wouldn't necessarily think that this behavior had anything to do with retardation, i.e. the child didn't understand what he was doing.
Just curiosity.
Curiosity or destructiveness. You have to separate the two out with the individual child. But, you know, a lot of these accidental fires set by 3 and 4-year-olds are just interested in matches. I mean, most kids are. It's within the realm of normal. Anything else? Okay. This is an interesting distinction. Terry Moffat was a sociologist who did this study. She called this adolescence limited versus life course persistent delinquency, and that has been a distinction that has really been useful. Most delinquency is adolescent limited. I don't know if you guys have backgrounds in this, but a lot of people have done a lot of stupid things when they're adolescents. Stolen things, whatever. I'll just tell you a quick story about my daughter, who is now a PhD clinical psychologist and trains for CASA. When she was 13, she went out the window of our house. She was on the first floor. Of course, we had no clue. I'll just back up a little bit. What happened is I was about ready to testify in juvenile court in Durham, North Carolina, where we lived, and she called me up and said, I have to tell you something. And then she told me this, which happened like 4 months before. My husband and I had no clue. She went out the window. She took my minivan, which she had never driven anything in her life. She went we live in the outskirts of Durham. Now, the inside city of Durham is not safe. But she had a friend there. So she drove this all the way into Durham, got her friend to come out to the car. Her friend goes, oh, can I drive this? Sure. So she lets her drive it. The friend forgets to turn the lights on. They go around the block in this like totally unsafe kind of deserted area, and a cop comes up to them. And don't ask me how this police officer missed these two 13-year-olds. But the other girl said, oh, I forgot my license. And she gave her brother's name, who basically had a name that could be either male or female. And he gave her a ticket for not having her license. So then my daughter leaves her off, gets back in the car, drives home, goes through all the lights, it's like 5 miles, puts the car there, gets back in the window, and goes to sleep. So I would call that adolescence limited. And I think the only reason that she told me is that this was going to be an issue as to going into court to pay this ticket. They didn't know what to do because this was not, she had to go into court, and she was 13 years old. Somehow her father ended up getting this straightened out and paying the ticket. But I give that as an example of something that probably a lot of people have done things like this. And generally speaking, it's risk-taking, thrill-seeking of adolescence, acting out. I can do what I want, right? You'll never find out. And then it goes. But there are life course persistent delinquents who are problems, become criminals for the rest of their life. Yes?
Well, both ADHD and conduct disorders seem to have an element where you grow out of it, or you can grow out of it.
Mm-hmm.
And I'm wondering if that's, you just learn how to adapt, or is it really, do you think, maturity?
Well, conduct disorder is a little bit different because it's generally not considered to have a biological basis. Although what we're finding out is that temperament of children is very important and what happens to them later. And one of the interesting studies with criminals is, imagine yourself in this study. Someone tells you that they're going to teach you something, And if you make a mistake, you're going to get an electric shock. Now, they have you all wired up to see your heart rate and everything. What do you think would happen to you?
Right, anxiety, right.
Right? Start sweating, get nervous. They don't. They just don't. So one of the issues is, does punishment do anything? Do they care? Do they see their behavior as having consequences? Maybe they're different. So that tends to be maybe a biological issue for some people, which makes you worry about people with their deterrent ideas, that, right, we're going to punish these criminals and we're going to deter the next one. If you are like this and you really don't react and don't have anxiety, it's not going to do much good. Let me just finish this. But basically, ADD we do think has a biological component to it. So you would have to separate those two out, and maybe ADD's biological component improves over time. We just don't know. Yes?
Isn't one of the aspects of conduct disorder a lack of conscience? Or maybe
Not
I'm
necessarily.
confusing that with it.
That's an aspect of antisocial personality in an adult. So if you have someone who's going to be an antisocial personality, they would have that. But most conduct disorder kids do have a conscience.
Everybody that the things that we talk about in here are confidential. Dr. Lindahl is sharing some personal experiences from patients she has seen. Some of you are sharing details, hopefully somewhat unidentified, de-identified from your own cases. And just a note that we are bound by confidentiality here.
Any questions in general before I start? Reactive attachment disorder, I think several of you have children that are diagnosed with this. This is a very difficult diagnosis to deal with. A lot of our failed adoptions, I assume that you probably have some CASA cases that are from adoptive parents. Once in a while you'll get a parent that just gives up and gives the child back with this. It's such a serious problem because it stems from extremely serious early neglect. Sometimes abuse also, but generally neglect. We do know from a lot of research that human beings cannot develop properly their brains or their emotions without touch and without some kind of attachment. We basically found this out from Bowlby was a researcher, John Bowlby in England, and Renee Spitz. And Bowlby looked at children in the hospital whose parents had left. And my first job when I was in high school was at a Shriners Hospital, which is a free hospital, free orthopedic hospital. And I was the recreation director. And what I noticed is that they had visiting only on Sundays from 3 to 5. So this was the way people thought you should do this at that point. So what would happen would be people would leave their children, if you can imagine this now, for orthopedic surgery, very painful surgery, and the mom would just leave. And they would come back on Sunday. So the children would cry and scream for a while. What do you think happened after that?
Just quit expecting anybody to
They
do
gave up.
anything.
Yeah, they gave up. And so people thought, oh, they adjusted. They're not crying anymore. And sometimes you'll see the judges. I've seen in custody cases, judges, Fairfax, Alexandria, Arlington, they'll come up with some crazy custody schedule where the child's 2 months old and goes back and forth, the parents, and then they'll say, oh, he'll adjust, which superficially he does because he gives up. So Bowlby did this original research, and then Spitz looked at the orphanages. And this is where people felt the way to run an orphanage was to give good physical care and never take the child out of the crib. Now, since that time, in the Western countries, we've changed that, but Romania had a particular problem. I don't know if any of you have Romanian orphans who just left their children, the babies, just lying there. And I actually went to the Baltics, to Lithuania and Latvia and Estonia right after the liberation with a group of pediatricians and child psychologists. And we saw there would be like a playpen as big as this room, and they would have babies around it, like this, all around the edge, just lying there. That was their view, and they would call it, one of the places we went was called the kindergarten for difficult children. That was cerebral palsy children. So the Soviet Union did not want to admit that they had any special needs kids, so this is what they did to them, and this is what you see. So in reactive attachment disorder, you basically have a child whose brain has not developed the ability to attach. Now, the brain has a plastic period. If any of you have tried to learn a language now, how hard is it?
It's really hard.
How about a 14-month-old? 2, 3 languages? That's because the brain is plastic at that age and can easily learn other languages. Once you get past a certain period, you're like us. It's really, really hard. Same with attachment. If you don't do it early, it's very hard to attach. And if you don't have anyone to attach to as an infant, you're not going to be able to attach. So we see basically 2 kinds of attachment disorders. One is a child who will not have anything to do with you or the foster mother, basically withdrawn, not interested, you pick them up, won't mold to your body, no affection. That's one type, and the other type is what we call indiscriminate attachment. The child will go to anyone because anyone's as good as anyone else. Nobody's special. That gives you a lot of problems as you get older. And these children have growth problems, learning problems. They tend to be very angry and do a lot of acting out. And what happens is the parent will come to you in despair. What am I going to do? Especially when they get to be 6, 8, and 9. They're just angry all the time. They destroy things. For a while in our profession, we had a very disgraceful thing going on. And actually, I think Fairfax CPS used to send their kids out to Colorado to one of these places for a while, till somebody snuck a tape out of what was going on. So some people in our profession decided that you had to be really dramatic for attachment disorder, and the way to do it was to break the child's spirit. So they would either tickle the child till they started going crazy, wrap them up in a mattress pad, drive them crazy till they're in a rage, and then they'd basically hold them. It's called holding therapy, so they couldn't move until finally they gave up, and that was supposed to help them. We also had some people that did rebirthing. They would basically do crazy kinds of things that sit on the child, like, the child was going to be reborn. Well, we had several deaths. Several therapists killed the children. One girl in particular that they smothered with a blanket. She kept saying she couldn't breathe, and they're like, too bad, you're going to get better. So those people went to jail, and that is finally out of our profession. But we still don't really know how to deal with this. The only thing that we can do is a lot of special education for the school, preschool, and a lot of love and limit setting from the family. But there's really no good answer to this really serious disorder. Substance disorders, I'm just going to talk a little bit about them. The difference between dependence and abuse. Dependence means that the more you take of the substance, the more you need to get the effect. And if you stop taking it, you have withdrawal. Abuse basically means that you are having trouble with the consequences. You're in trouble with the law, you're in trouble with your family, you're in trouble at school or work. That's the difference between them. The thing is, there doesn't seem to be any, quote, crack baby, which is what we thought when this epidemic first started. I just gave you a quote from 30 leading experts that have done 20 years of research, and they have not been able to find any particular syndrome that comes from this that's different from any other drug, for example. Like your baby was also neglected.
Right.
So how do you separate out those two issues? So this has turned out to be better than we thought. On the other hand, there is a particular syndrome from alcohol. Has anyone had a fetal alcohol syndrome baby? You have?
I haven't, but I know of a case I was talking about the day about one.
Mm-hmm. You
This
can
is
identify
Russian adoption.
Russian, right. There's a big problem with Russian adoptions because the reason that most kids are taken away in Russia is alcohol. So the kids that get adopted tend to have that. You can generally figure it out by looking at the facial characteristics, and usually it's accompanied by retardation of some kind or severe learning disabilities. So basically drugs themselves are a problem, and it does not seem to be any particular crack baby syndrome. Yes.
Oh, when you say facial characteristics, is it like, you know, Down syndrome, you can see it right away, what would be?
It's not as obvious. They just have certain facial. It's sort of hard to describe, but they don't look as obvious. You can see any Down's child, right? But you have to know what you're doing to see a fetal alcohol child. Psychosis. This term has many meanings. It's even, a lot of people will just talk about, oh, he's psychotic, right? Meaning he's crazy. The DSM requires certain symptoms, and these are basically the symptoms that show that you are not in touch with reality, right? You are somehow out of touch with reality. There are many disorders. You'll see in the pack I gave you, schizophrenia, several schizophrenic type disorders, delusional disorder, brief psychotic disorder, which sometimes you can have with a terrible shock, substance abuse, and medically induced psychosis. Does anyone know anyone who has woken up from anesthesia crazy? What happened?
She didn't panic, a basic panicky kind of thing. Actually, both of them had one wisdom teeth. One woke up, almost woke up. She was having the tonsils out. Which, yeah, she remembers it. She remembers. The operation took longer than the normal. I mean, she was an adult. She was still okay. Thank goodness.
But you can wake up from anesthesia psychotic. It's temporary. We had a friend who had kidney cancer, and he had his kidney out, and he, hopefully this didn't really happen, we think it didn't, thought that he was awake during the surgery, and really had a very brief psychotic episode, and then he was back to his own normal self. So if you see someone who's psychotic, it cannot necessarily mean schizophrenia or mental illness. You have to really evaluate it medically to see what's going on. Schizophrenia, several subtypes. We talked about catatonic a little bit before, which is very rare now. Paranoid, I think you all know, paranoid schizophrenic. Disorganized is a person who just does not know what they're doing, does not know where they are, is not oriented. Undifferentiated is just, we don't know. They have some characteristics and we don't know what type they are. The age of onset is 20s usually. It's not curable at this point. We don't know what causes it. We do know there is a genetic component to it. Somebody talked to me in the break about a person they know. Yes, you did. Can you tell us a little bit about that person and what?
Well, actually, it's a little strange because they're actually 33. And brilliant person, very brilliant. Living at home with mom and dad, doesn't have a job. Talk to them one-on-one, and normal person, you never know, but they've been writing letters to like the vice president and like all of these like governmental heads, and they're saying things like, I feel like, you know, people are watching me and stalking me and hurting me and transmitting, you know, messages to my right ear, and she goes on to name like people who are basically in the news, like Ted Kennedy or Nancy Pelosi, or, you know, various people like this. And I mean, to read the letter is, I mean, just someone who you know is very intelligent, but the content is just very, very disturbing. And it's just reaching out.
That person sounds like they have delusional disorder rather than schizophrenia. Sometimes it's hard to tell the difference between them, but delusional disorder, you don't have hallucinations usually. Delusional disorder, some criminals have that will do a really crazy thing and then plead insanity to the jury, but they look very sane like this, so the jury doesn't buy it. Schizophrenia generally does come on earlier than later, 20s, teens sometimes. I can tell you one quick story about a schizophrenic person that I saw. Very interesting guy. For some reason, a lot of delusions are about John the Baptist, Jesus, right? God. Those are often the delusions that you see. And he, as a child, he was crossing the street and a bus caught the back of his heel And so he had a lot of surgeries, and then he had to have his shoe built up. So that was his childhood trauma. One day he was driving across this place, the street where he had been hurt. He was a UVA student at that point, and John the Baptist had oral sex with him while he was driving. So he became very ill, started to drink a lot. I saw him for some time, and this was an absolute fixed thing. Now, maybe you wouldn't care if that happened, except that he thought he was very religious and he was going to go to hell for this, because you're not supposed to have oral sex. So he became suicidal. So what do? You have a person with this delusion who's suicidal because of this delusion. He was a hard person to see. He was very intelligent and well educated. So one day he came in and said, I just have a question to ask you. Do you believe that I had sex with John the Baptist? Well, one of the things you know is you really don't want to try to talk someone out of their delusion, because it doesn't work. So I'm sitting there thinking, what am I going to say? So I'm like, well, I don't know. I'm not really exactly sure. And he goes, well, it's a good thing, because otherwise I'd have to get a new psychologist. However, I was there. You weren't there. I was there. So you see that he went on one side of it, like, I know this is something, and he knew his diagnosis. I know this is schizophrenic. On the other side, I was there. And if you have a hallucination, it does feel like you're there. So in the end, it was really sad. He basically drank himself to the point where he ended up in the hospital long term, because he just could not deal with the idea of going to hell. He couldn't kill himself because he would go to hell, but on the other hand, he was going to go to hell later. But what was he going to do? So that's a real schizophrenic person. And it's a very hard condition to have. It's relatively rare. Prognosis, some people do fairly well. A lot of people don't. There's a kind of schizophrenia where you just kind of go downhill for the rest of your life. You probably heard these medications, those of you who say you have CASA cases with the schizophrenic. Haldol, Trilofan, Thorazine. You heard of those? Any of your clients on those medications? One of the problems, that was the first generation of antipsychotics, and when you see, like One Flew Over the Cuckoo's Nest, those kinds of things, that's what they drug the people out with. This is what the Soviet Union did to their dissidents. They put you in the hospital and drug you up on these for years. Now, the problem is they have very bad side effects, and there's something called tardive dyskinesia, which tends to be permanent, which is basically this, forever, and other kinds of stereotyped movements. So we decided it's not such a good idea to drug people like this for so long, but on the other hand, this did get rid of the hallucinations and delusions. So a second generation was developed, which you probably heard of, Risperdal, Zyprexa, Geodon, Seroquel. These do not have the same side effects, although they do have side effects. And I had a young woman in my office the other day who started to take Geodon, and right in front of me, her muscles started to contract like this. It was really scary. This is one of the side effects of Geodon. Now, the interesting thing is different medications affect people differently, which is why when you send someone to a psychiatrist, they just kind of, I think I'll try this, I think I'll try that. You don't know what the side effects are going to be. So who had a schizophrenic person in here? Someone said before they...
I asked
Well-
her, it's a case that I'm just learning about, so I don't have the particulars on it yet.
Mm-hmm. Somebody else did? What was your person like?
Sorry, I didn't get the question.
What was your person like that was schizophrenic? What was characteristics of the person?
Characteristics, she would be lost in the world of nature.
Mhm.
Pretty much just not involved. And this happened, a lot of this happened, I've read through the history of the cases before I met the mother.
Mm-hmm.
The mother was taken out of the family, medical investigation, she's away from the family now. I've just met her a couple of times with people. So based on the history, ignores children, she's being violent, like being, especially when it comes to the issue about taking medication specifically. when she takes medication, she's been forced to take medication. She was active in 90%.
Well, why do you think a schizophrenic would not take their medication? Because what?
I've heard from someone else that it feels better not to be medicated. They don't like the medicated.
They don't like it, and also there's nothing wrong with them. Right? Because in their world, they're correct, yes.
The case that Karen was referring to, the mother was actually, the child came into care because she was at a Starbucks and she went up to a police officer and told the police officer that somebody else in Starbucks was part of the Russian mafia and was trying to kill her. So that was her, how her son came into care, and she continued to have those. And she is on medication now. I don't remember the exact ones, but she did have quite a few of those.
Has anyone seen A Beautiful Mind movie? He was a very brilliant schizophrenic who, the movie was not actually accurate. He really did take medication. It looked in the movie like he talked himself out of his hallucinations. I don't know if any of you saw the tape of him with his son, who's also schizophrenic, and John Mack was berating his son, like, I don't understand why you can't stop having these ridiculous ideas. He still didn't quite get the idea himself. But he did get a lot better. This is one of the, I think it's a current CASA case, a 12-year-old Latino boy whose English is fluent, so you can't blame this on his English. Abuse, neglect, multiple foster homes, father incarcerated, kind of your usual multi-problem. His house with his mother, filthy, there were mice in his bed. He told the evaluator, I'm used to living with cockroaches and rats, I just don't like the crunching of exoskeletons. Witnessed domestic violence, I mean, anything you can think of, it's happened to this kid. So he came in with the flat affect that we were talking about, visual hallucinations, and this was one of his statements. All the pictures, the lady had a shocked picture because it was near Christmas and X was going to sit on her lap and he got scared, so she picked him up, and while she was picking him up, she got a huge strange face while doing her picture, and she was always wanting to do her picture. That's schizophrenic talk, right? At the same time, he went to a dark place and was talking about murder and so forth. So this person diagnosed him psychotic disorder, NOS, not otherwise specified, didn't feel that he fit enough of the criteria, maybe not long enough a time or whatever. You also don't like to diagnose 12-year-olds with schizophrenia. This generally doesn't come on till later. So there's so many factors in this case as to why this kid is like this that it's going to be a very mixed diagnostic picture. And PTSD also was the diagnosis. Does anyone know that child in here? What, does this sound like him?
I mean, I haven't had much experience with him personally, but from what the CASA has told me, yeah. Although sometimes the CASA says that he's perfectly fine, he doesn't exhibit anything like what was reported in the evaluation, so it feels like it's almost a different person at times.
Well, this is why diagnostic issues are so complicated and why this is not an exact science, right? You don't know what is causing this.
What is the potential problem with diagnosing psychotic disorder, NOS, as opposed to coming out and diagnosing this child with schizophrenia?
Well, you don't generally diagnose children with schizophrenia, although it is a classification. But some people think it doesn't exist, some people think it does. The age of onset tends to be late teens, early 20s. So who knows? This child has a Hispanic background. Maybe his English isn't quite as fluent, although it said in the report that he preferred English and did the evaluation in English. He's got so many things going that I wouldn't want to diagnose him anything without learning a lot more about him.
Does that change the treatment? Is he at risk for not being treated appropriately if they're not really willing to give him that schizophrenia diagnosis?
Part of the problem is the medications are very strong, and they have side effects. And so if you can not give a child, a 12-year-old, that medication, I think it would probably be better to give him an anti-anxiety medication and see if you could work with that symptom that way. But it's a very complex picture that he has. Yes?
One of the things that we see as CASAs is that sometimes a child goes from many different therapists during the time that we see the case. And we often have information that we feel this psychiatrist should know about and they should talk to me about, and we're forbidden to do that. In order to treat a child, how much background is needed from what's been done before with other therapists?
What are you forbidden from doing?
We're forbidden from giving information saying, you know, he's been having trouble with this in the past and you should talk to him about that. We can't, they have some information, but sort of limited information sometimes from what's been treated in the past, and we're not able to give any of the information that we know to say. We sometimes think that they need to talk to them about certain things or pursue certain things, and we can't transmit information. So as a therapist, what type of information from other therapists is it not necessary? You just go by what you deal with and see in front of you, or do you need more should we be pursuing getting that information to the new therapist?
Well, I think it's kind of an unfortunate policy. You can see why you have it. But for me, I think diagnosis is so complex a lot of times that you need every bit of information you can get. For example, if you find out that this child has never done this until this evaluation, that's one piece of information. If you find out that he's been talking like this for 5 years, that's a different piece of information. So for me, everything you can possibly get. And I think one of the reasons that you all, at least the reports that I've seen, you have so many different diagnoses. You know, this person says this, that person says that, because people don't necessarily follow these categories perfectly. And someone looks different from one evaluation than another. Sometimes you have a not very good evaluation. The person isn't really very skilled at looking at this. So it's a really complicated problem. Yes?
I have to piggyback on that subject. When I introduced myself, mentioned that my young man has had many different diagnoses in the span of 3 years. And one explanation I heard that I was given for that is that when he went into foster care, he's a neglect case, when he went into foster care, the dynamics started kicking in, and over the span of that period of time, his life experiences have changed so dramatically as he's been in the system and in different placements, that his personality has actually changed as he has had these experiences in foster care.
What are his diagnoses? Do you remember some of them?
One of them was bipolar, another was depression, problems with authority figures. I've gotten substance abuse diagnoses. I can't remember some of the others. Did I say depression? Depression was one of them that he got. Anxiety was in there somehow.
Well, part of the problem is bipolar. We're going to talk about it in a minute, but it's pretty overdiagnosed, and